So just as I mentioned earlier, this is now going to be a discussion about the patient journey. So it's much more interactive, but I'm going to leave it to each of the folks in each of the panel to really take it away, and then we can ask questions and so on. So the first to join us is the Lansing panel. I'm not sure if we can see them up on screen. There they are. Welcome, you guys, to the symposium. It's so great to have you. Just the video is just stunning in its clarity. We could see you all really in great, striking color. Thank you so much for being here, and I know that Dr. Jatin Rana will be discussing the new patient or new diagnosis. So in a way, what we've just heard, it can be sometimes one of the scariest visits during a patient journey when you just heard that you've been diagnosed with cancer. So Dr. Rana, I turn over the podium to you, and you can run this panel. We will eagerly await learning some of the experiences from you and also your panel members. Thank you.
All right. Thank you, Dr. Heath, and thanks to Detroit, and we're in Lansing now. So we have a wonderful turnout today here in Lansing, so I definitely want to thank everyone for making the journey here. I have a wonderful panel today. Along the journey of cancer care, there's a lot that happens with different providers. Doctors are involved early in diagnosis with radiology, biopsies, pathology to review that. But the focus really is on the patients, but also the other members of the care team. And so that's why we have 3 different panels today. Our first one will talk about new diagnosis. I'm going to hand it off to others here, but introduce myself first quickly. So I'm an associate professor with Michigan State University. You can read my CV online, but what I wanted to share was my physician journey with Karmanos, actually. So I started out as a volunteer. So kudos and maybe a round of applause for all the volunteers throughout the whole network. So that was my earliest opportunity to work with patients. I worked there at Detroit at Karmanos Center. Got to actually do some research as well at the same time. We have an opportunity to work with Dr. Egley, Susan Egley, Dr. Albrecht, who I don't know if all these names are still there or not, but I know Dr. Egley is there. But I had an opportunity to look at research and trying to look at the questions asked by patients when they're trying to enroll in clinical trials. And so I think my opportunity to work as a volunteer and that research really helped this young college kid decide that medicine was the right path. So I want to share with me. I'm going to hand it off to our great panel that introduce themselves and kind of talk about how they help you along the way as patients and caregivers with a new diagnosis of cancer. So.
Hello, my name is Sarah Barber. I am the breast cancer nurse navigator here in Lansing. I started my career at McLaren in 2010 as a nurse's aide on our inpatient oncology unit. I started in that position and put myself through nursing school. I really developed a love for oncology patients. I think it's a unique population, and I just really enjoy it. So when a position became available in the outpatient oncology world, once I became a registered nurse, I jumped at the opportunity. My role when someone is newly diagnosed, they are referred to me typically by their breast surgeon or somebody else on the care team, and I meet with them at diagnosis and help them understand what's going on. As a lot of you know, a cancer diagnosis is confusing, it's scary, there's a ton of emotions that come along with it. You get a lot of new doctors out of a diagnosis, you hear lots of words, and I'm just here to help make sense of it. So typically what my role looks like, I'll meet with a patient when they're diagnosed. I like to start by going in the room with a pathology report and a highlighter and a pen. And I sit down with them one-on-one and help them make sense of the diagnosis that they see on paper, because we live in a world where everybody's gonna go home and get on Google and they're gonna do their own research. And my goal is that they understand what they're researching on Google. I also have a list of credible online resources where people can go to help teach themselves. I individualize that education to the patient because not everybody learns the same way. That's one of the first questions I asked. I want to teach you some things. How do you learn best? Sometimes that's explaining, sometimes it's drawing poorly done pictures on a piece of scrap paper. Sometimes it's giving them books. Everybody is just different. Another thing I do is assess any barriers to treatment, whether that's transportation issues, people who may be struggling financially before diagnosis, and they're fearful that this diagnosis is going to create financial toxicity for them. Identifying these barriers early on so that we can intervene early before it becomes a big problem. And then I'm here to make referrals to appropriate resources for the patients, whether it be Ashley, the financial navigator, our social work team, community resources, transportation assistance, all of that kind of thing. I'm also always behind the scenes, following patients, making sure that they're showing up to appointments, helping coordinate imaging visits or doctor's appointments. I'm a central contact person for our patients because they have so many new doctors. Sometimes it's confusing and they don't know who they're supposed to call. I tell them, start with me. I'm a good person to start with. I'm a direct phone line. I usually have the answer, and if I don't have the answer, I can get it pretty quickly. One of the major things I always tell my patients, I don't work for any of the physicians. I work closely with the physicians at the cancer center for the patients. So I'm here to advocate and do whatever, really. That's about it.
Hello, my name is Ashley Gregory. I'm a financial navigator here at the Karmanos Cancer Institute in Lansing. I have been with McLaren for about 8 years. I have done a lot of registration and insurance verification for patients outside of this current role that I'm in. So for this current role, I do a lot of authorizations for the infusion center as well as the radiation oncology center for oral medications, and we do a lot of financial assistance, and we work pretty closely with social workers, and like Sarah stated, we get some patients in that are having financial toxicity, and they're referred over to us so we can help them out and give them different financial assistance guidelines and things that we can offer to help them. For the infusion center, we do get direct messages from the physicians, and they let us know if a patient, what the patient needs and what type of medication that they're going to be receiving. We then look at their insurance information, make sure that they're active, make sure that there's no issues, and if there are, we try and contact the patient and get that issue resolved with them, whether it be calling the insurance and seeing what their active status is and changing it, and letting the patient know if there's any issues with their insurance, and so that we can help them. So for insurance authorizations, we go through portals, phone, fax, and we consult with our providers and get all the clinical information that we need to let the insurance know what type of medication that the patient will be on. And once we're able to do that, we get the authorization so that we know that insurance will pay for it. A lot of the issues that patients are having is their insurance is not allowing them to get certain medications because they're not FDA approved, or I'm sorry, not, sorry, I'm very nervous. Okay, thank you. So there are a lot of medications that we have to just find for the patient to make sure that they're covered, make sure that their insurance is going to allow them to have this medication. We have different places that we look for assistance for patients. McLaren itself has a financial assistance program that we often get patients in coming forward to sign up, and we help them with that process. When patients receive oral medications, mostly my coworker, Eric, he works on a lot of our oral medications, but we are able to find assistance for those patients through the drug manufacturers. Some of those medications they have copay assistance programs, so we're able to find those, and I know those are a lot harder for, research purposes. You may find some places that say that they're there to help, but they're really there to scam, and so we try and find reputable sources for our patients to make sure that they can get the assistance. We also do third-party, like Healthwell, Leukemia and Lymphoma Society, Patient Advocate Foundation, and we also look through Fund Finder to try and find different assistance programs for our patients. We also can coordinate with and confirm assistance with specialty pharmacies like KSP. We work very closely with KSP. And yeah, that's about it. Thank you.
Before you go, I just want to say, the financial coordinators throughout the network are amazing. There's a lot of concerns when a patient's first diagnosed, what biopsies to get, which doctors to see, and kind of Sarah highlighted how the navigators help with that aspect. Finances is one of those things we certainly don't want patients to be worried about, and many times our offices can work miracles to make sure, as long as these drugs are approved, we can get the insurance to pay for that, because doctors are great with working with the doctors, and other members of the care team, sometimes we have struggles with the insurance companies, and we certainly don't want that to be a burden when you're first diagnosed with the cancer. So sorry to interrupt. Bill, go ahead.
Oh, that's all right. That's fine. You can interrupt anytime you want to. My name is Bill Winkler, and I am unpaid staff, okay? I am the guy that works with everybody in this room. I'm the advocate. And what does that mean? I mean, what do you do when you're an advocate? Well, the first thing you do is you educate yourself about cancer. I come to Karmanos because my education started when I was 23 years old with my mother, and through successive decades for friends that have been struck with cancer, to 2010 when my wife died, and 9 months later my daughter came down with leukemia. That's how I got involved with Karmanos. They asked me if I would get involved, and I said, yeah, because I'm an advocate. I just didn't know that at the time. So I think the thing that's important to understand about advocacy is that it's not really a clearly defined title. You do a lot of different things, and you talk to a lot of people, and you use that self-education to try to translate for folks that have heard a diagnosis of cancer to help them more fully understand what that journey is going to look like. It starts with, and maybe some of you can relate to this, the first time you received the diagnosis of cancer. I wrote down, as we were talking this morning, I wrote down some of the experiences that I went through with the people that were involved with cancer in my life. And that first diagnosis kind of initiates something called shock, and then fear, and then anxiety, and then trust, and then hope, and then confidence, and then determination. That's how I see the flow. That's how I see people that I've known in my life be affected by a first diagnosis and move forward to deal with what they're confronted with as much courage as they possibly can raise. And sometimes it's hard to find that courage. And that's when I step in and I say, well, let's take a look at this and let's see what the possible outcomes are. One of the advantages that I have is that I have a science background, and so I kind of have an understanding of what that's all about. And I was asked to join the Institutional Review Board at Wayne State University through Karmanos. The Institutional Review Board addresses the issue of clinical trials. The Institutional Review Board looks at every protocol that comes through the university from a researcher that wants to look at new medication My job on that review board is to make sure that patients that involve themselves in a clinical trial are going to be protected. And so, in many instances, I have an opportunity to speak to patients. And sometimes, you have to take into consideration, not everybody that gets a first diagnosis of cancer has that supporting family. Some of these folks are single individuals who may in fact not have a family or not have recourse to anyone that is able to sit down and talk to them about those fears and anxieties that I just elaborated. And I think it's imperative for me as a person to be able to have an opportunity to speak with those people, not necessarily one-on-one, but sometimes one-on-one, but in most instances to address groups of people like this, where we're at today, to give some sort of reassurance that it's a really, really important thing to do a number of things. And that is, first of all, look at your symptoms and understand your symptoms and not recoil from your symptoms, to investigate those symptoms, to investigate that kind of sneaking suspicion something might be going on, to get those tests that are done that we've talked about so far, to make sure that you're not missing anything. The problem is, as Karmanos is trying to do, is to spread education and knowledge throughout the entire state. That's why we do this in Flint, and it's why we do it in Lansing, and we do it downtown. And hopefully, as we expand, we'll do it throughout the state. But we want to educate people, to give them all of the information that they're going to possibly need to have to find the volition to have that test done and to confirm or disprove that suspicion they might have. That's imperative. So that's my job. And I do it as frequently as I possibly can. I don't get invited to parties as much as I used to because I keep talking about the same thing all the time, and I say, let's not invite Bill because we know what he's going to talk about. So basically, that's what I do. And I do it as often as I possibly can. And I'm more than willing to answer any questions that you might have as folks that have found themselves in this issue. And thank you for your attention.
Thanks, Bill. And as you're thinking about those questions, it looks like 4 of us, but we have a 5th panelist. I don't know if Steve Kaurala can chime in.
Yeah, good morning, everyone. My name is Stephen Kaurala, and I'm the Pharmacy Ambulatory Manager for Karmanos Cancer Center. In that role, I oversee 2 of our retail pharmacies at Karmanos, one in Detroit, as well as one in Farmington Hills. And then the thing that I want to focus on today is KSP, which is McLaren's Specialty Pharmacy. So what is a specialty pharmacy? A specialty pharmacy is a pharmacy that does well at helping patients with cancer, and I always like to focus that the person comes first before the cancer, help them navigate that care journey. We know that medications can be expensive. Some of the medications we dispense are from $200 a month all the way up to and over $40,000 per month. And so we know that's a cost burden. We absolutely realize that. But at a specialty pharmacy, we're there to help reduce those barriers within the McLaren system for all of our McLaren subsidiaries. So what we do is ultimately a McLaren provider will send a prescription over to KSP, and instantly, if we get a flag that the copay is greater than $50, we're going to be proactive about that and try to reduce that financial barrier as much as we can. We're going to look for free drug programs, we're going to look for copay assistance, and then ultimately, with the help of all the McLaren subsidiaries, this year alone, McLaren has provided more than $1 million to offset copays for our patients, to make sure that that is absolutely not a barrier. And so we're very pleased to work with our hospital partners to make sure that we can reduce that as much as possible. And oftentimes we're able to get it so the patient's copay is $0 or at least $20 or so, which seems to be more manageable. But we understand that everyone is within a unique situation. One of the other things that we do as a specialty pharmacy is we know that these drugs can cause side effects. So every single month before we fill that prescription, we're going to follow up with that person and say, hey, what's going on? We want to hear you. We want to know. And the great thing about using KSP for those services is that we're integrated within the McLaren Healthcare Corporation. And so we have access to the electronic medical records. We have access to speak with the physicians and the prescribers, almost in real time so that we can take care of things. We're also available 24/7. We have staffed hours up until 6 p.m., but after that we have a call line. So anytime a person is experiencing something, a side effect, or just has a general question about their therapy, even if it's at 11 o'clock or 3 a.m., we get those calls, and we're here to listen. When you call our after-hours line, it's going to be a clinical pharmacist who is trained in oncology that will be answering all of those questions and telling you how to manage that side effect or answering your question. So KSP is really here to help along the journey, putting the person first, and then recognizing that that individual has cancer, and we're going to help along that journey. So thank you.
Thanks, Steve. So those are our panelists, and we talked about the theme of empowering survivors, and part of that, Bill did it wonderfully by saying educate and advocate for yourself. So education, you may sometimes see your doctors with a new diagnosis talk about the National Comprehensive Cancer Network, the NCCN, and that's a terminology that provides some guidelines for the physicians of what treatments to discuss with you with a new diagnosis as a patient. But it's important to also know that there is an NCCN guidelines for patients, and that's a wonderful resource for patients or caregivers to learn about the cancer. That's probably a better resource than Google. And so I certainly think that's an opportunity that if you don't know about that, to check that out. It's put into terminology that is meant for patients and caregivers and not physicians. So I think that's a way to educate yourself. In addition to express and advocate for yourself, the NCCN also has a tool called a distress thermometer. You may see this as a new patient to Karmanos and other cancer centers, and it's important because it highlights some concerns that you may not really realize that are there until you see it on paper. These are concerns that are physical concerns, maybe pain, memory, maybe there's tobacco use issues that have to be dealt with. There's emotional concerns with the diagnosis. Many times the reason why your thermometer score might be high is just not knowing what questions to even ask or what's the next step. So that highlights that aspect there as well. But practical concerns as well, transportation concerns now with the new diagnosis. Is food an issue, right? We have a food bank here in Lansing. Many may not know about that. That's a new addition we have here at our cancer center for patients not to have to worry about that perspective. And then the last thing beyond the distress thermometer that is helpful to advocate for yourself is the ask. And this is a asking questions. It's a pamphlet that we discussed more recently as physicians and other providers that is going to be rolled out throughout the whole network of Karmanos. It's an opportunity for patients to really basically figure out what questions you need to ask a doctor on the first visit. And it's been shown that just having an opportunity to look at that list of questions and highlight those questions so that you're prepared when you're meeting the doctor for a new consultation can be very helpful. And then that allows the physician then to work with the rest of our team to get you the right resources. So certainly want to open it up to questions before we end here for our panel. If there's any questions for our nurse navigator, financial coordinator, our pharmacist, and then of course our superstar Bill.